This video will show you how to properly administer your enteral gravity feed. Please follow all instructions shown in this video. Administering gravity enteral feeds can be safe and easy with proper instruction. When your enteral formula arrives, it should be checked to make sure the containers are intact and dry. If there is leaking of the formula during shipment, it may cause contamination of all formula containers in the shipment. Formula should be stored at room temperature range of 68 to 77 degrees Fahrenheit, as extreme temperatures may spoil the formula. Avoid direct heat, sunlight, and damp places when storing your unopened enteral formula. It is important not to freeze any liquid formula. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds and dry as well. Use a separate towel to turn the faucet off. Feeding tubes vary and require different supplies. Some feeding tubes will have clamps and some will not. Traditional feeding tubes can be used with a slip tip or cone-shaped syringe, while ENFit feeding tubes require supplies with special ENFit connections. Your nurse or dietitian may recommend using a valve attachment device at the end of your tube to open and close it. These too have traditional and ENFit options. The valve adapter for the traditional tube has a cone-shaped attachment that is inserted into the tube. The valve adapter for the ENFit tube has an ENFit attachment that is screwed into the tube like this. Gather the ordered amount of formula for your feed, cup of tap or bottled water, IV pole, gravity bag with tubing, and your 60 cc syringe. Follow the packaging instructions, as the formula may need to be shaken if it is in a can or bottle, or kneaded if it's in a bag container. For traditional feeding tubes, you will use the cone-shaped connector that looks like this. For ENFit feeding tubes, you will unscrew the cone-shaped connector like this and connect it to your ENFit tube. You will need to flush your feeding tube with water to confirm that your tube is not clogged. Start by filling your syringe with water as directed. Attach the syringe to the tube or valve connector. If using a valve connector, open the valve and slowly inject the water into your tube. Next, close the valve and remove the syringe. Remove the gravity feeding bag with the tubing from the package and close the roller clamp on the tubing. Fill the feeding bag with the prescribed amount of formula for your feed and close the bag. Hang the bag on the IV pole. Next, pinch the drip chamber to fill it to the line with formula. The tubing will need to be primed to remove air. To do this, slowly open the roller clamp to allow the formula to fill the tubing. Then close the roller clamp. Next, connect the tubing to your feeding tube or attachment device. Make sure the tubing is securely placed in your feeding tube to prevent formula leaking. You may need to secure the tubing with a piece of tape. Unclamp your feeding tube or open the attachment device valve. Slowly open the roller clamp to adjust feeding rate as instructed by your nurse. When your feeding is complete and all the formula has drained from the bag, close the roller clamp on the tubing. If you are using a valve connector, close the valve. Remove the tubing from your feeding tube. After your feeding, you will need to flush your feeding tube to clear the tube of formula. Start by filling your syringe with water as directed. Attach the syringe to the tube or valve connector. Unclamp your tube, or if using a valve connector, open the valve and slowly inject the water into your tube. Next, clamp the tube or close the valve and remove the syringe. Rinse your feeding bag with warm tap water and allow to air dry by hanging with the top open. Feeding bags with tubing should be replaced daily, and syringes should be replaced weekly. After use, they can be disposed of in your household garbage. Wash your syringe with warm water and dry. The syringe can be stored in the original packaging until its next use. Empty formula containers should be disposed of in your household garbage. Open containers of liquid formula can be stored in your refrigerator for 24 to 48 hours depending on the product. After 24 to 48 hours, open formula containers should be thrown away. Open containers of powdered enteral formula should be stored in an airtight container in a cool, dry place for up to 1 month. Once powdered formula is mixed, the liquid formula must be refrigerated and used within 24 hours. Unused powdered enteral formula should be disposed of after 1 month. Contact your dietitian for product storage instructions if you have any questions. Wash your hands thoroughly for at least 20 seconds and dry as well. Use a separate towel to turn the faucet off. Proper enteral bolus feeding at home is important to your safety. In the event of an emergency, always call 911.